Hi, I'm Kevin. I'm a 42-year-old plumber and I've noticed pain and swelling in my knee.
Hi, I'm Erica. I'm a student massage therapist, and today, with Kevin, we're going to be going over his health history, pain questions, and interview questions. So Kevin, we'll start off with your health history. You have it there in front of you if you just want to follow along with me.
Yeah.
So, you're a plumber.
Mm-hmm.
What's your primary complaint?
I have anterior knee pain and it's swelling in my right knee.
Okay. We're just going to go through the respiratory and the cardiovascular and all the other things there. So do you have any cardiovascular problems like chronic cough, shortness of breath?
No.
No? Okay. Any cardiovascular, so high blood pressure, heart attack?
No.
Any infections, so hepatitis, HIV?
No.
Skin conditions, rash, athlete's
No.
foot? Okay. Any other conditions, so diabetes? Alright, so head and neck, vision problems, vision loss?
No, nothing.
Any current medication?
No.
Are you taking for it? Okay. No surgeries or anything that you've had?
No.
So, where exactly is the location of your pain?
Right in the front.
Okay.
Yeah. There's a bit of swelling there too, I feel.
Okay. When did this happen, so the onset of your injury?
It was about 2 weeks ago after work, I noticed that.
How frequent is it? So does it hurt all the time, or is
Yeah, like pretty much every single day since it started.
Okay. Duration. So how long does it usually last?
So it starts between 1 to 2 hours, like into work.
Mm-hmm.
So like 9 or 10, and then like for most of the day.
Okay. So does your pain refer anywhere? Does it move up or down the leg or anything
No,
like
it's
that?
mainly just localized there.
And on a scale of 0 to 10, 0 being no pain, 10 being the worst pain ever felt, where would you rate your pain?
About 8.
8?
Mm-hmm.
What's the quality of the pain? So is it dull, achy, sharp?
Yeah, it's a dull and achy.
Dull.
Yeah.
What aggravates it? So what makes it worse?
Like long-standing, like hours, like 2 or 3 hours after.
Okay.
Yeah, and constant like up and down movement, like my kneeling and sitting and stuff.
Mm-hmm. Does it disrupt your sleep at all?
A little bit.
What makes it feel better?
Ice.
Are you taking any medication for it?
2 extra strength Advil.
Any other comments that you want to add?
No.
Okay. So we'll move on to interview questions now. So has there been any change in your daily activities?
Just an increased work shift. I've taken an extra 2 hours each day. It's a busy part of the season.
I guess so. Has this type of pain happened before this most recent onset?
Just occasional knee pain, a bit of strain, but never this bad.
Have your sleep patterns been affected?
It is painful to sleep. Normally take 2 Advil prior to going to bed. But I am up through the night still.
How long have you been a plumber for?
About 18 years.
How long are your shifts usually?
About 8 a.m. to about 4. Now I'm normally working up to about 6. So,
how did the pain start, and do you remember what made it hurt initially?
I landed hard on the ground on my right knee while I was doing a repair.
Has the pain increased since the onset?
It increases during work and constant up and down movement.
Okay. Have you seen a doctor about the pain?
I have an x-ray scheduled next week.
Are there any additional symptoms that happens with the pain?
I just get a little tired, a little loss of energy.
Have you been to another therapist, like physio, chiro, for the pain?
No.
Okay. So during my observation with Kevin, I noticed that he has an antalgic gait. He's guarding his right knee because of the pain that he's feeling, and he's trying to avoid putting weight on his right knee just because it hurts so much. It's really visibly swollen and red, and the right hip is higher from him hip hiking, so there's a misalignment in his hips there.
Okay, Kevin, so we're going to be going through an assessment. With the assessment, it's going to induce a little bit of pain just because we might be going through some painful ranges of motion for your knee. So if anything becomes too painful, just let me know and we can stop. If you have any questions, just let me know and we can make any modifications that we need to. Do we have your consent?
Yes.
Great. So first off, we're going to be going through some ranges of motion. So we're going to do flexion and extension of your knee. So we're going to start with the unaffected side first. And I'm going to get you to flex your knee up like this for me. And I'm going to measure it with my goniometer.
Okay.
Okay, Kevin, go ahead and flex your left knee up. Wow, that's fantastic. Go ahead and relax. And now I'm going to get you to fully extend your knee. So it's going to be a motion like this. So from neutral to extension.
Okay.
Okay? And I'm going to measure it with my goniometer. So whenever you're ready. Fantastic. Was there any pain there?
No.
Okay, awesome. So now we're going to be going through the same thing with your right side. And I'm going to get you to flex your knee for me.
Oh, that hurts.
Oh, that was painful?
Yeah.
Okay, so that was a grading of about 100 degrees with the goniometer.
Okay.
And I'm going to get you to extend your knee as well.
Oh, that hurts.
Okay, so that's no movement in the right knee at all. And it was painful? Okay. So now we're going to be doing some passive movements.
Okay.
So if you can come and lie on the table for me. Okay, so now we're going to be doing some passive movement. So you let me know if it hurts at all. We're going to start with your left side. Any pain there?
No.
Okay. Now we're going to move on to your right side.
Oh, that hurts. Ow. Ow.
Oh,
ow.
painful. Okay.
Ouch.
Okay. Now I'm going to get you to sit for me. And I'm going to start with your left side and move it into extension. How does that feel, Kevin?
It's just a nice little stretch.
Nice little stretch, okay. And onto your right side. Let me know if it becomes too painful.
Oh, that hurts. Ouch.
Too painful? Okay, so we're not going to continue with the movement. And now we'll do resisted. So we'll start with your left side. And I want you to push up into my hand for a count of 10. 1, 2, 3, 4, 5, 5, 4, 3, 2, 1. Relax. Any pain there?
No.
Now onto your right side. Push into my hand for a count of 10.
Ah, that hurts.
Okay, so we're not going to move forward with that movement. So now we're going to do resisted flexion. So I'm going to stabilize just above your knee here, and I want you to push into my hand for a count of 10. 2, 3, 4, 5, 5, 4, 3, 2, 1, and relax. Was there any pain there?
No.
And I'm going to stabilize, and I'm going to get you to push into my hand for a count of 10. So,
Oh.
okay, that's too painful, so we're not going to move forward with that.
Okay.
Okay, Kevin, so I'm just going to get you to do some movements with your other joints. So it's called rule out. So first we're going to do, I'm going to get you to do hip abduction. Okay, Kevin, so I'm going to get you to bring your right leg out. So I'm going to get you to abduct. And I'm going to place overpressure. And is there pain there?
No.
Awesome. And now I'm going to get you to flex your hip upwards. So with a bent knee, I'm going to get you to bring your knee to your chest. Any pain there?
No.
Overpressure? Any pain?
No.
Awesome. And now, with your ankle, I'm going to get you to point your toes up. Any pain there?
No.
Okay, and then I'm going to get you to bring the sole of your foot inwards. Any pain there?
No.
Awesome. Okay, so we can rule out your hip and your ankle and say that your knee is the culprit. Okay, so doing the range of motion of Kevin's knee, we noticed that during active flexion on his right knee, it was only 100 degrees with the goniometer and a pain of 8 out of 10. On the left side, it was 130 degrees of flexion with no pain. Passively, the flexion one on the right knee was 110 degrees with no pain, and on the left side, it was 145 degrees with no pain. And resisted flexion on the right side was 2 out of 5, and on the left side it was 5 out of 5. Extension actively. On the right side was 0 with an 8 out of 10 pain scale, and on the left side it was a rating of 5 degrees with no pain. Passively, on the right side it was 3 degrees, no pain, and on the left side 5 degrees, no pain. And for resisted, on the right side it was a 2 out of 5 rating, and on the left side 5 out of 5 rating. So today with Kevin, we're going to be going through 2 tests where he's going to be supine. The first one is the tap test, which I'm going to be tapping the patella, and we're testing for a fusion of the knee. So Kevin is supine, and I'm going to tap on the patella to see if the patella moves. The patella doesn't move, so that would be a negative rating. Now we're going to be doing the swipe test, which also tests for fusion. So what I'm going to do is I'm going to swipe superiorly 3 times on the medial side, and then come over and swipe down, and I don't see a wave of fluid moving over, so this test would be negative. So now we're going to go through the bursitis tendinitis differentiation test, and this is going to help me differentiate from a tendinitis injury or a bursitis injury. So if it's a bursitis injury, then the pain is going to be felt with a small contraction, and if it's tendinitis, then the pain won't increase until we reach the highest contraction. So Kevin, I'm going to get you to push into my hand for a count of 10. 1, 2, 3, 4, 5. 5, 4, 3, 2, 1. Relax. And what was your pain rating?
I'd say like an 8 out of 10.
8 out of 10.
Mm-hmm.
Now we're going to come into the next range, and I'm going to get you to do the same thing. So 5, 4, 3, 2, 1. 1, 2, 3, 4, 5. Relax. And what was your pain grading there?
Like an 8 out of 10.
Okay. I'm going to come into the next range, and I'm going to get you to push up into my hand. So 1, 2, 3, 4, 5, 5, 4, 3, 2, 1, and relax. And the pain grading there?
Like an 8 out of 10.
Okay, and into our final motion, and I'm going to get you to push into my hand. 1, 2, 3, 4, 5, 5, 4, 3, 2, 1, and relax. And what was your pain grading there?
8 out of 10.
So because the pain stayed the same and it was a high level of pain throughout the entire range of motion, we can say that this is a prepatellar bursitis of the knee. So with prepatellar bursitis, Nick Price from Emergency Nurse says that we're going to be looking for swelling, redness, and heat. And we can see here that the knee is very swollen. It's very hot to the touch, and the tissue is kind of spongy. So we can tell that there's a lot of synovial fluid buildup in there, and I can't really palpate the patella because of the buildup of the synovial fluid.
So, for the treatment today, our impairment goals are to reduce swelling in that right knee, to increase the range of motion in the knee, and to decrease the resting muscle tension in the quads. Okay, so today we're going to be mainly working on the right knee. I will only be undraping the parts that I'm working on at a specific time. So there's no cautions or contraindications, but we will not be able to touch the patella because of that burst underneath. The benefits of having this massage is that it will get better. We'll feel much better over the week and progressively over our treatment plan. So the risk of this treatment, it may feel a little sore afterwards and it may be a little painful during treatment. Consequences of not having this treatment is that it won't get better, it will stay the same, it may even get worse. So you're completely empowered. Let me know if I need to change anything, if it hurts or if there's something I need to change, let me know. If you want me to stop, tell me to stop, that's completely fine. I will be checking in on you every so often. If I come across something that I can't treat, I will refer you out. Is there any questions?
No.
Do I have your consent?
Yeah.
Perfect. So I'm going to get you to get in between the sheets, undress to your comfort level. Skin on skin is best. I'm going to go wash my hands. He Cho et al. Did a study using MLD as a therapy. MLD has been shown to improve blood circulation and other tissue fluids. MLD was also found to relieve pain. So we're going to start with manual lymph drainage to reduce the swelling in the knee. We're going to pump the terminus to start with. So next we've got to pump the inguinal nose. This is in your bathing suit line, so is that okay if I do that?
Yeah.
So normally I would do that 3 times, all the way down to the bottom of the leg. So I'm going to place the ice pack on your knee. We're just going to check for a starter if it's okay. How does that feel?
Feels great.
Feels good? Okay, we're going to leave it there for a little bit. I'm going to get back to the quads. Working on the quads. How's the ice on the knee?
It's definitely turned into a burning sensation.
Okay, so when the ice pack starts turning your knee numb, or it feels like a numb sensation, just let me know and we'll take it off.
Okay. Wow, feels pretty numb.
Yeah, feels numb?
Yeah.
Okay, so let's take that off. So I've got my ice cube. I'm just going to do some ice massage. How does it feel?
Feels great.
Now we're going to do some passive range of motion. So I'm going to get you to pull tight on that and hold it secure for me. This might have a little bit of pain, so just let me know. How's that feeling?
Feels okay.
Feels okay? Back down. Then we'll go again. Does that feel okay?
Yeah.
So one thing that we recommend for your home care is doing some deep diaphragmatic breathing. So I'm going to go through the steps with you. So I'm just going to place my hand on your abdomen here, and you're going to breathe in for 5 seconds. So breathe in, 1, 2, 3, 4, 5, and then exhale for 6. 1, 2, 3, 4, 5, 6. We're going to do it again. So breathe in for 5. 1, 2, 3, 4, 5. And exhale for 6. 1, 2, 3, 4, 5, 6. One more time. Breathe in for 5. 1, 2, 3, 4, 5. Exhale for 6. 1, 2, 3, 4, 5, 6. There you go. Bye-bye.
So another thing we recommend for you to do at home is something called progressive relaxation, and we would recommend for you to do it before you go to bed to help you sleep. So with progressive relaxation, you're going to lie in a supine position, so on your back, and really create a relaxing environment for yourself. You're then going to start with your feet and your toes, and you're going to tense them up. And you're going to hold that for 5 seconds. You're going to tense them up, and then you're going to slowly release them. And from there, you're going to move upwards your body, and you're going to use your legs. You're going to tighten your legs, and then you'll release. And then you'll come up to your glutes, and you'll tighten your glutes, and then release. And then you'll come to your core, and tighten your core, and then release. And then your hands, you'll tighten them, and then release them, following up your arms to tighten, and then release. Your shoulders to tighten, and then relax. And then up to your head and your jaw to tighten, and then relax. And this should really create a really relaxing environment for yourself, pain-free, and then you can have a good night's sleep.
Another thing to do at home would be to ice your knee twice a day, no more than 10 minutes on, and following the C-band principle. So cold, burning, aching, numbness. When it gets numb, take it off right away.